Hello and welcome to For the Love of Family. My name is Katie. I am currently studying neuroscience and psychology at Northern Kentucky University, and this video is to help spread information of binge eating disorder and help families, help loved ones, and kind of explain some of the causes, the effects, and things along those lines. Just a quick disclaimer, I am not a licensed physician, I am not a licensed clinician, so please, if there are any concerns, seek professional help. I will provide links in the description of websites that have more information, as well as places and ways you can get treatment in your area. The DSM stands for the Diagnostic Statistical Manual, which is what most clinicians in the United States use to diagnose psychological disorders. So for binge eating disorder, the DSM criteria is as follows. A recurring episode of binge eating disorder. An episode of binge eating is characterized by both the following: eating in discrete period of time within any 2 hours, an amount of food that is definitely larger than most people would eat during a similar period of time and under similar circumstances, and a lack of control over eating during those episodes, as in feeling that one cannot stop eating or control how much they are eating. The binge eating episodes are associated with 3 or more of the following: eating much more rapidly than normal, eating until feeling uncomfortably full, eating large amounts of food when not feeling physically hungry, eating alone because of feeling embarrassed by how much one is eating, and eating feeling disgusted with oneself, depressed, or feeling guilty afterwards. A marked distress regarding binge eating is present. Binge eating occurs on average at least once a month for 3 months, and binge eating not associated with recurring use of inappropriate compensatory behavior such as bulimia nervosa does not occur exclusively during the course of bulimia nervosa. Anorexia nervosa methods to compensate for overeating, such as self-induced vomiting. So it is possible to have some dangerous behaviors but not be diagnosed with binge eating disorder simply because of that time restraint. For instance, if you don't do it within a 2-hour time period, if you go longer than that, or if you don't mark off 3 or more of the following. But if there is still a problem, you will get a diagnosis with something. It just might not be binge eating disorder. It's also important to remember that the subtype of anorexia binge purging subtype has that restrictive element of it. This has no such thing. And also bulimia, as this can kind of be confused with that, there is no purging in this sense, so this is just having full bouts of binge and you still have the guilt afterwards, but you don't do any you don't do anything to compensate for it afterwards. The causes are hard to narrow down for eating disorders, specifically because it's usually not just one cause. So there has been some genetic link to it. For instance, if the mother suffers from an eating disorder, their child is more likely to suffer from the eating disorder, but it's not solely based on biology and genetics. Culture also plays a role, just as circumstance plays a role as well. Circumstance meaning if there was a traumatic event, eating disorders could develop as a coping mechanism, or if there's a big life change, if there's a big life change, some people may develop eating disorders as a way to cope with that. For instance, moving into high school, moving to college, things along those lines. It is important to remember that eating disorders can happen to anyone of any age, race, sex, gender, anything like that. Though in binge eating disorder, the onset age is typically older than the other common eating disorders, as it typically occurs in the late 20s, and the balance between men and females is pretty even, whereas with anorexia and bulimia, it is usually geared more towards females. Comorbidity is when somebody suffering from one psychological disorder also suffers from another one. So in this case, those suffering from binge eating disorder are more likely to suffer from anxiety and depression. Those two are very common. However, OCD, body dysmorphia, low self-esteem, perfectionism, substance abuse, and many others could also occur. These are some warning signs for those who could be suffering from binge eating disorder, though it is important to remember that you could have none of these warning signs and also still have binge eating disorder, just as somebody could have all of these and not be diagnosed. So continually eating even when one is full, an inability to stop eating or control what is eaten, stockpiling food to consume secretly at a later time, eating normally in the presence of others but gorging when isolated, experiencing feelings of stress or anxiety that can only be relieved by eating, feeling of numbness or lack of sensation when binging, never experiencing satiation, the state of being satisfied no matter the amount of food consumed. So, experiencing feelings of stress or anxiety that can only be relieved as eating might just be dismissed as stress eating, as a lot of us do, but it is important to remember that this isn't an extreme and dangerous and deviant way, not just in the case of eating ice cream when broken up with. It's also important not to downplay binge eating disorder just as overeating, because this is a true disorder and a problem. The lack of self-control is a big thing that separates this from overeating. And the guilt and the secrecy of it is also an important thing to look out for when discerning from just overeating and binge eating disorder. The effects of binge eating disorder on the body can kind of be broken down into some of these parts of the body. I think this diagram is wonderful at doing that. And so obviously weight gain is a huge one that is seen in most people, but it can cause a plethora of different problems. One thing a lot of people don't think about is it can affect the pancreas, specifically in causing type 2 diabetes. The heart is also affected with high blood pressure, high cholesterol, increased risk of stroke, and increased risk of heart attack, as well as it can affect the brain and causing anxiety, depression, guilt, and being distressed from the behavior. If you're interested in more of the effects, I will leave links in the description with a more detailed list, some personal stories, and some doctors' inputs on it, so you can check out a full list of effects on the body. I want to emphasize that recovery is possible through proper treatments and therapies. A lot of people with binge eating disorders do fully recover. There are options when looking at treatment, though typically most people choose outpatient. There is a checklist that can provide in the description below that will show if you truly need inpatient, though typically outpatient is more available to various individuals. CBT stands for Cognitive Behavioral Therapy, and this type of treatment looks at your cognitions, your thoughts, and the behaviors that are then associated with those. So the cognition of being very stressed, and then the behavior of gorging yourself and eating a lot, looking to not only get rid of the negative cognition or have coping or discover other coping mechanisms for it, but also decrease the negative behavior of that to improve the overall health of the individual. FBT stands for family-based therapy, and this is an approach that looks at the family structure as a whole. So instead of just improving the individual, it improves everyone in their environment, all of their loved ones, so that their entire environment improves and it's easier for them to recover and stay recovered for longer. This is a new and upcoming treatment that a lot of people have been looking into and looking at, a lot of clinicians, and it has shown very successful recovery times and very successful length of recovery. Everyone is different. Everyone shows signs of their disorder differently. So, like I said earlier, if somebody has warning signs, it's possible that they do not suffer from binge eating disorder, just as if somebody shows none of those warning signs, it's possible that they do suffer from binge eating disorder. So if there are any suspicions or doubts, please seek help from a professional who can properly diagnose you and give you the correct help for your situation. If there are any further questions, I would love to answer them in the comments below. Feel free to share any personal stories that you have and support each other in the comments. Thank you for coming back to my channel.